Hello, welcome to my channel. The title of my video today is Admission, Interviewing and Assessing. Please hit the like button, please subscribe, please share this video. Today we are doing all these questions are from RN NCLEX examinations. We are back to question and answers today. Before your patient is admitted, for example, from the emergency room, and you will be admitting your new patient to the floor. The question is, when you admit your patients, you will be doing an interviewing with your patients. That's what admission really is. When you first meet eyes with your patients, you're going to sit down. You're going to be interviewing your patients. So the question is saying, before an interview, you should know or do what? The correct answer, the question is saying, before the interview, you should know what? All the things you should know before you start your interview. The purpose of the interview, you should know how your data will be used. You should schedule enough time. You should gather all the equipments you're going to need before you introduce yourself to the patients. And you should know that you're going to call your patients by the preferred name. So when you meet your patient, you're going to say, what is your name? My name is Jane Smith. What would be your preferred name? What would you prefer me to call? What would you prefer me to call you? And the patient will say, call me Miss Smith or call me Jane. But before you start interviewing, you meet this patient, you will know what will be the patient's preferred name. The next question is, in admission and interviewing, we have standards of steps for all nursing procedures. What are your standards of steps for admitting and interviewing your patients? This is a question. The answer is mentally review your steps for all your procedures. Next, check all your doctor's orders, collect all your equipment, and wash your hands before you start the interview with your patients. You are also, during your admission and interview, the next thing you're going to do when you're finished that, you're going to do a head-to-toe assessment. So when you first meet your patients, you're going to be doing a head-to-toe assessment. And the answer is saying, you identify, you take a look at your patient's wristband, identify your patient. Can you tell me what your name is? And you look at your patient's wristband, and you're going to prep your patient to do this assessment. You're going to lie them in bed, you're going to cover them, pull the drapes, you maintain privacy. So the answer is provide privacy and safety. Make sure the side rails are up. You don't know if the patient is confused as yet. You don't want your patients to fall out of bed. And you'll use standard precautions. You'll use aseptic techniques for your interviewing and your assessment of these patients. After you're finished assessing your patient's head to toe, you will remove your gloves and your personal equipments. Wash your hands at the end of this procedure. Then last, you'll report, record, and document your procedures. So these are our standards of steps when you're interviewing, admitting your patients. It's a new patient, the patient is on the bed. You're gonna do a head to toe assessment, wash your hands, you have your equipment, you do your head to toe assessments, aseptic techniques, standard precaution, gloves if you need, gowns, and then at the end you dispose of, make sure your patients are safe, the side rails are up, and you report and record your procedures. These are all standards of steps for admission, interviewing, and assessing your patients for the first time. These are standards of steps for all hospitals. The next question, when you start your interview, what do you do? When starting an interview, what do you do? The answer is you provide privacy. And when we say when you're starting your interview admission, you pull the drapes. Make sure everywhere is clean to present your interview for your patients. You provide privacy for your patients to start this interview. If the families are there, you excuse the family, you pull the drape, and you provide privacy. The next answer is sit down to communicate with your patients at eye level. When you have an interviewing and admission, and you're going to ask the patients 1,000 questions, everybody has to be comfortable. The patient has to be comfortable, the nurse has to be comfortable, and the nurse is going to sit at the bedside at the eye level. That's why the nurse is going to be sitting in a chair. The nurse must be at eye level when doing her admission interviewing, asking all these questions so that the patient can be comfortable. The next answer is do not have patients feeling rushed. When you're doing your interview in your admission, when you're asking the patients 1,000 questions, it's a lot of questions you're gonna do. Not let the patient feel rushed. Be calm, be gentle, empathize feelings. The next answer is check your patient's anxiety level. Check your patient's anxiety level before starting this interview. Is your client afraid? Is your client anxious? Ask the client, are you in pain? Would you like me to give you some pain medication before this interview? Maybe the patient is having a headache. Patient will say, yes, I'd like 2 Tylenol before you start this interview. So you give the patient the pain medicine. Everybody must have a relaxed, calm environment. Provide privacy for this interview. Sit at eye level in a chair beside the patient using active listening. Active listening. Do not let the patient feel rushed. The nurse should have a relaxed posture during the interview. Avoid asking the patients why. Do not ask your patients why during the interview. Avoid jargons. Avoid jargons. Avoid difficult words that the patient do not understand. Avoid medical terminologies. Use simple words. Most patients do not understand medical terminologies during an interview admission session. Use open-ended questions during an interview, admission interview. you want your patients to elaborate. Do not use closed-ended questions that answers yes or why. When you're starting your admission interviewing with your patient, start with neutral topics until you and the patient feels more comfortable with each other before going to more advanced topics. So in an interview, you'll start with neutral topics and you use open-ended questions. During an interviewing, the answer is ask patient what problem he or she is experiencing today. Ask the patient, what brought you here to the emergency room today? These are all the questions. Empathy means understanding the feelings of the patient. Emphasize while you're interviewing your patient. Choose what the patient says and what you observe. Choose what the patient says and what you observe. For the nurse, during an interview, she will provide a healing presence by listening, active listening. Some patients have complex issues. Nurses emphasize do active listening. Interviewing should be based on age and developmental and body part function. Interview should be based on age, developmental, body part function. Ask the client, when did this problem start? Today is Thursday. Ask the client, when did this problem that brought you here start? Was it, the client will say, last night or this morning? When you're interviewing client, ask the client, assess chief complaint. I'm having a headache. I'm having an abdominal pain. These are the chief complaint that brought me here to the hospital today. Nausea and vomiting. Ask how often does your symptom occur? I was vomiting after I bought some Chinese food or Italian food or soul food last night. It stopped for 6 hours, but this morning when I woke up, I still continued vomiting. Ask how often does the symptom appear? Ask what makes it better or ask what makes it worse. If the patient came for a headache, the nurse is saying, okay, you were having a headache last night and you still woke up back with this severe headache. Ask the client what makes it better or what makes it worse. The client will say, last night when I developed this headache, I took 2 Tylenol. It was relieved and I went off to sleep. But this morning when I got up, my pain scale 0 to 10, my pain scale was a 9. So I decided was to come into the emergency room, ask what makes it better. I took 2 Tylenol last night. It was relieved. I went to sleep. Ask what makes it worse. Ask the client what she or he has done to relieve the complaints. And as I said, this patient took 2 Tylenols that relieved it for a while. Okay, please hit the like button, please subscribe, and please share this video. Stay tuned to part 2 on admission, interviewing, and assessment. When you first accept your patients, you'll know everything to do before the admission starts, and you know everything to do when it actually starts, and you know everything to do during the admission process. Thanks for listening. Have a blessed day. Part 2 will be followed. Have a good day.